When patients come to us for breast augmentation, oftentimes they'll ask, what are the chances of getting rippling? With the prevalence of the internet and all of the information available, patients can actually see photographs of other patients who've had this particular complication. Rippling is the appearance of the ripples of the implant showing through the skin. Every implant has wrinkles in it. The saline implants have a little bit more prominent wrinkles, and these are a little bit sharper edged than the silicone implants. Now, silicone implants can still show wrinkling, but probably to a lesser extent than the saline implants. When we do see wrinkling, the most common place would be on the side of the breast. A patient would come in, for example, and say, when I lean forward and look at the side of my breast, I can see some wrinkles. Fortunately, when they stand up, the wrinkles usually go away, so usually it's not a real problem. Sometimes we don't see the wrinkles, we just feel them on the bottom of the breast, again, where the tissue is more thin. In the most severe form, we might see wrinkling in the top part of the breast, which is a real problem because it can't be concealed with bathing suit and other type of briefer clothing. To approach this problem, if the patient has had their augmentation on top of the muscle, it might be a good idea to place it underneath the muscle to provide more coverage. If it's been underneath the muscle and we're still seeing rippling on the top part of the breast, we can go in and add another layer of substance called alloderm. Alloderm is human cadaver skin that's been treated in such a way to remove the cells that would cause rejection. This will add another layer and hopefully conceal the rippling. Sometimes the pocket itself is too big, and by tightening the pocket either with the alloderm or another substance called stratus, we can tighten the inside pocket. Unfortunately, those substances are quite expensive, and so it's a rather expensive fix. One other technique that we might want to employ would be fat injections just underneath the skin. We can take fat from a different part of the body, process it, inject it underneath the skin, allowing us to provide a more cushion between that implant and the overlying skin.